If today you're thinking about getting dental implants, it's completely normal to feel unsure and wonder whether now is the right moment. Many patients come to me with the same question: should I move forward or wait a little longer? And I want you to know that understanding this can save you from rushed decisions that later become very difficult to fix. Not long ago, I treated a 64-year-old man who had lost 3 teeth due to gum disease. Even so, his bone was strong and his mouth was in good condition, which made him a good candidate for implants. But the day before the surgery, he walked into the office holding his phone. His daughter had sent him a viral video, and that video left him feeling completely confused. What did the video show? It talked about a Japanese researcher and his team, and the possibility that teeth could grow back naturally. After watching the whole thing, he looked at me and asked, "Doctor, should I wait, or should I get the implants tomorrow?" That question, which is probably on your mind too, does have a clear answer. And today I want to give it to you in a simple way, based on science, not on rumors or viral clips. Right now, there is serious research underway on a biological mechanism that all of us carry inside the bones of our jaw. This mechanism has been there for decades, inactive and silent. And what's surprising is that the Japanese team managed to activate it in animals. But there's a crucial detail, a detail that is rarely mentioned, and it completely defines who could truly benefit from this development and who couldn't. Today I'm going to explain what this protein does, the one responsible for stopping dental growth as we get older. I'll also tell you exactly what the Japanese team achieved and, most importantly, who this future therapy could work for and who it likely won't. Viral videos usually skip the most essential part. Stay with me, because understanding this may help you avoid a mistake that could affect your long-term oral health. To understand this potential medication, we first need to understand the body itself. Why do we stop producing new teeth when we reach adulthood? There's an important anatomical detail that almost no one mentions. Your jaw still has dormant structures inside it, like tiny biological seeds waiting for a signal to wake up. After your last permanent tooth came in, those structures stayed there, hidden and undeveloped. This isn't a metaphor, it's real anatomy. So the obvious question is, if they're there, why don't new teeth appear? Why don't they activate on their own? Because there is a natural break, a biological switch that stops the process. That break is called USAG. And what is USAG? It's a protein produced by your own body. Its job is to tell those structures that they've already done their part and should not keep growing. It's like an electrician shutting off the main switch after finishing a job. Nothing is wrong. The system just doesn't need more energy. That's exactly what this protein does. It keeps the system turned off for life. In animals like sharks, that switch doesn't exist. That's why they grow teeth forever. The same happens with crocodiles. Even elephants have several sets of teeth throughout their lives. But in humans, that mechanism has been inactive since ancient times. Thousands of years ago, it made no sense to live past 40 or 50, so the body didn't prioritize keeping the process running. And yet, the biological foundation is still there, asleep. That is why the Japanese research team has spent 15 years trying to turn that switch back on. And yes, they found a way to do it in animals like mice and ferrets. A single dose of the antibody they developed blocked the effect of the USAG protein. What happened then? Those dormant structures woke up and started forming new teeth, fully functional, with the animal's own genetic information. No grafts, no lab-made parts, no artificial components. The body built the tooth on its own, but here's the part almost no one mentions online. That switch can be activated, yes. But for a new tooth to grow, that biological seed has to exist. If it isn't there, tooth formation is impossible. And this small detail, which is often left out, completely changes every person's diagnosis. That's why it's so important to understand what stage the human studies are in, and what it really means to have or not have that seed in the bone. That is what determines whether someone could be an ideal candidate. Before we continue, if this information is helping you and you want clear, reliable, and practical guidance for your dental health, I invite you to subscribe to Dr. Gabriel Mena's channel. We share helpful content every day so you can take better care of your mouth and make confident decisions. Now, how is the research progressing? Is it realistic to think about a medication that can grow teeth? In September 2024, The Japanese team took a historic step in regenerative dentistry. If you're unsure about getting implants now or waiting for these new therapies to become available, it's important to understand exactly where the research stands. That is what will help you make a responsible decision tailored to your situation. The Japanese team reached a key milestone by launching the first clinical study in humans. Adult men between 30 and 64 participated, all treated at Kyoto University Hospital. And I want to make one thing completely clear. This first phase is not meant to prove that the medication can grow teeth in people. The main goal is to determine whether the substance is safe and whether the body tolerates it without adverse effects. Every medical study begins this way. In the initial phase, researchers watch for risks, toxicity, and any warning signs. And so far, no significant problems have been reported. That's good news. But let's interpret it correctly. Being safe does not mean it already works in humans. It only means the path forward is still open. Then comes the phase that actually tests effectiveness. Later, another phase confirms results with larger groups of patients. And finally, if everything goes well, health authorities review the treatment. Think of it like checking the foundation of a house before a big remodel. There are no walls, no roof, and the construction permit is still missing. That's where things stand now. They've completed the first review. When could this medication reach the public? Scientists optimistically mention the year 2030. And yes, it's possible. What we cannot guarantee is that it will happen exactly then. In science, timelines often shift. So the key question appears, will you be someone who could benefit from this medication once it becomes available? The answer depends on your bone, how long your tooth has been missing, and the overall condition of your mouth. What does this medication do? It activates those dormant structures I mentioned earlier, the tiny seeds capable of forming a new tooth. But for them to activate, they must still be there. They need support, a place to anchor inside the bone. That space is the socket where the tooth used to be, what we call the alveolus. When a tooth is lost, the bone begins to shrink. As it recedes, those structures can also disappear. Put simply, the medication can nourish the seed, but it cannot create one that no longer exists. So, who has the highest chances of benefiting? People who lost a tooth recently, whether from trauma, deep decay, or a fracture. In those cases, the bone is still present and the gums are healthy. The seed is still intact, making the treatment more plausible. Something similar happens with patients who have a genetic condition called hypodontia, people born without certain teeth. That is why the next study phase will involve children with this condition, because in them those structures are still untouched. And who has fewer chances? Those who have had untreated gaps for many years or those with severe periodontitis that has damaged the bone. If the bone is gone, the medication has nothing to act on. I'm reminded of a patient I saw a few months ago. She had lost a molar nearly 10 years earlier and never replaced it. When I examined her, the bone volume simply wasn't there anymore. And unfortunately, even if this therapy existed today, it wouldn't work for her. She told me, "Doctor, I wish I had looked for help sooner." I share her story so you don't wait too long. There are other important factors as well. Age, for example. Stem cells lose energy over the years, reducing their ability to form new tissue. And certain medications matter too. If you take treatments for osteoporosis, especially bisphosphonates, we need to be cautious. They act directly on the jawbone and can block the emergence of a new tooth. A responsible professional always evaluates this. On the other hand, common medications like metformin or statins have shown no issues. There's something else that's rarely discussed. The USAG protein doesn't just regulate dental development. It's involved in a biological pathway related to bone formation, skin, and hair. It plays a major role in animals, and in humans it's still being studied. So far, in the current study phase, no tissue damage or concerning signs have been observed. Everything looks good, but researchers need to monitor a larger group before drawing final conclusions. And this leads to a very common question. What if you already have implants? In that case, there is no conflict. An implant occupies the space where a new tooth would grow, and the medication cannot act underneath titanium. Put simply, these therapies don't interfere with implants, nor do they replace them. And this is crucial. Today, in most cases, implants are still the best available solution. The real chances of benefiting from future therapies increase when the tooth loss is recent and the bone is healthy, and they decrease when many years have passed and bone loss has occurred. You don't need to sit around waiting for this medication to be released. What you do need is to prepare yourself, and that preparation starts today. Going back to the case I mentioned at the beginning of the video, that 64-year-old man who came in with 3 missing teeth and good bone density, I remember clearly how he showed me the viral video on his phone. After listening to him and examining his mouth calmly, I knew the path was obvious. He had all the biological conditions for this treatment to potentially help him in the future. But today he had a real, immediate problem. Missing teeth were affecting his bite and putting his bone at risk. So I told him, with the honesty I offer to all my patients, "Miguel, this treatment is not available in clinics yet. But you cannot wait. Today you need a solution that protects your health. We're going to place implants. And in a few years, when we know more, we'll reevaluate together if another option becomes available." And he agreed. Today he is stable, eating better, and protecting his bone. That decision brought him peace of mind, and I'm glad to share it with you because it can help you avoid mistakes you might regret later. And that is exactly the point. The most common mistake is not waiting for a Japanese medication. The mistake is neglecting your mouth while you wait. Think of a classic car enthusiast who knows that in a few years the perfect replacement part for his engine will come out. He won't leave his car stored without oil or maintenance. He takes care of it more than ever. Because when the part arrives, he wants the engine to still be alive. Your jaw works the same way. If new therapies eventually appear, they can only help you if the foundation is healthy. So what can you do to protect that foundation? First, treat any gum problems you may have. If you have inflammation or periodontitis, you need to stop it as soon as possible. No regenerative medication can work in infected tissue. Professional cleanings are not a luxury. They are a requirement to preserve the support you may need in the future. Second, avoid leaving empty spaces. When a tooth is missing, the surrounding teeth start shifting and the bone begins to disappear. Months without a temporary replacement can reduce your future options. Talk to your dentist about how to maintain that space. Third, stay away from miracle products you see online. No supplement, rinse, or drop can block the USAG1 protein. That technology does not exist in an online store. And some of these products, besides being a scam, can permanently damage your gums. My job is to give you clear information so you can make sensible decisions. I don't want you to cling to false promises, but I also don't want you to lose the opportunity to benefit from what science may bring in the future. That's why I appreciate that you're here, investing time in learning and taking care of yourself. Before we finish, I want to ask you something important. If this content helped you, I invite you to subscribe to the channel, activate the notification bell, share this video, and leave a comment. We upload new videos every single day, always committed to giving you useful, simple, and evidence-based information. Your support helps us reach more people who might need this today. And I also want to extend a deeper invitation. Let's give thanks to God for life, for the opportunity to learn, and for allowing us to make decisions that improve our health. Each day is a gift, and taking care of ourselves is a way to honor that. Here on Dr. Gabriel Mena's channel, we are grateful to accompany you, guide you, and help you build healthier habits. Tomorrow you'll have a new video, and I would love for you to watch it. I'm sure it will be helpful. This is a warm, trustworthy space created for you.